Hello, my name is Dr. Drrogu, and I am one of the many instructors for the website called adoptioneducationclasses.com. Today, I'd like to speak to you about international travel and transition during the adoption process 101. International travel. For some, this period is a very exciting time. For others, it is another component of the adoption stress. Fortunately, very soon after you adopt your child, all the facets of the adoption stress created by the adoption process, the document preparation, educational seminars, financial drain on resources, mixed emotions, medical uncertainties will all soon disappear after the successful adoption of your child. Taking care of your health and your family's health during international travel is also imperative to the successful completion of the adoption process. After all, your newly adopted child needs a healthy family to come home to. Now, some travel preparation for families. Preparing for medical emergencies while traveling abroad is very, very important. It is one of the most important aspects of the adoption process. The less that you have to worry about the health of your child and the health of the other family members that are traveling with you, the more you can focus on the big picture, your adopted child, and successfully completing the adoption process. The medical precautions required for adoption travel depend on the country that you will be traveling to. Obviously, if you're traveling to a big city in one of the industrialized nations, too many medical problems will not be experienced. But if you're traveling to parts of the world where it's a developing nation, then more specific medical precautions need to be implemented. Once you're informed of your travel dates, you should make an appointment with either your internist, pediatrician, or a travel physician in order to determine what special precautions need to be taken in order to secure a healthy journey for you and your loved ones. Now, why is this visit with a travel physician important? Well, there are a number of reasons. Firstly, you need to determine if the routine immunizations that you have received here in the United States are up to date. Many people are lacking in that updated tetanus booster. After they went to college, they got their last tetanus booster before their college physical exam, and then after that, no more. Sometimes routine immunizations are not sufficient, especially if you're traveling to third world countries. In some countries, special vaccines such as typhoid, yellow fever, Japanese encephalitis may be required to fight off diseases that are not routinely seen back home. A travel physician is knowledgeable in these medical illnesses and conditions that exist in different countries. It is very important that you allocate sufficient time before you travel in order to obtain the vaccines required, and some vaccines, such as the hepatitis A and the hepatitis B, require a series of boosters, and they require a certain amount of time in between each booster. Now, your health is your responsibility. Do your own research and due diligence. There are a couple of very, very good websites on the internet that have a multitude of information. TravelDoctor.com, PassportHealth.com, the International Society for Travel Medicine, the Centers for Disease Control, CDC.gov. These websites offer up-to-the-minute global health-related information. An adoption medical specialist is another physician that you should consult with while you're traveling overseas. The adoption physician is aware of health concerns that exist in countries from where families are adopting from. They also provide vital educational support, especially for those with blind referrals. These physicians will be able to provide medical records and video evaluations while you are overseas. Their educational support services will help you to understand the complex issues that may be found on the adoption reports, and they will help you to make an educated decision about your referral. They will, in the least, lessen the adoption stress. They can also help parents to deal with issues and concerns that creep up on you during those first few days after you adopt your child and you live in a hotel room. They are basically a lifelink to the United States. Now, antibiotics. I've been approached many times by families about whether or not they should take some antibiotics with them while they are overseas to pick up their child. Antibiotics are used to treat ear infections, respiratory infections, and minor ailments. But the best plan is, if your child is so ill that there is a requirement for antibiotics, then take the child to a physician. A physician is a physician no matter where they're from. There are many types of antibiotics available out there, and each one treats a different ailment, and only after an adequate physical examination can one determine what antibiotic to use. While you are overseas, there are many American-like facilities in different countries, and I am sure they would be very happy to treat your child. Now, an adoption travel pack, that is something that parents should take with them when they travel. And I prepared a list for you that you can print out and take with you on the road. It is wise to bring an adoption medical kit with you in the remote possibility that the child is ill. In most countries, medication is available at the local pharmacies, but you may not be able to read the label or understand the instructions for that matter. The commercial adoption kits have all the necessary items required in smaller dosages, and they cover an array of medical problems. They have dosing charts in there to tell you how much you should give your child for a particular weight or age. There are a number of commercial adoption medical travel kits available on the internet that you can purchase, but you can make your own. Now, some of the health problems that families sometimes encounter during their travel, fever and cold symptoms are the most common. There's cough, congestion, runny noses, body rashes, diaper rashes, sometimes allergic reactions or hives, pink eye or conjunctivitis occurs, sometimes with children that have a chronic condition such as asthma or recurrent ear infections, vomiting and diarrhea. These are common pediatric problems. Now, the adoption medical kits basically are little bags that have small doses of the common things that one would need to treat common pediatric symptoms. In this list we have Tylenol and Motrin, obviously, to treat fevers, Oragel or Ambisol to put on the gums of children of teething age in case they have teething problems, or older children that have dental cavities. Different types of cold, cough, and congestion medications such as Triaminic, Pediacare, Sudafed are very good to handle these minor respiratory symptoms. Antihistamines such as Benadryl would be used to treat a common allergic reaction. Different types of aloe vera gels are useful to use for regular routine burns or sunburns. Triple antibiotics like Neosporin or Bacitracin are very good to use for different types of abrasions, cuts, burns, scrapes. If the child has some type of rash, hydrocortisone cream would be good. For simple diaper rashes, triple paste cream or A&D diaper rash cream, adequate. A small tube of Lotrimin would help to treat yeast infections. Now, some children that live in orphanages might have seborrhea of the scalp, and this could be treated with T-gel shampoo. Unfortunately, we do have the occasional case where the child has head lice. So over-the-counter Rid or Nix shampoo is good. Other common problems that we often encounter in children are obviously constipation, and if this occurs, a glycerin suppository will help you alleviate the pain of constipation. You would like to have a thermometer to measure the temperature. Obviously, a dosing syringe, oral rehydration salts. Those are very, very good because they are little packets that get mixed with water, and it helps to rehydrate the child in case they develop a stomach virus and they have vomiting and diarrhea. Now, for a mild case of diarrhea, kaopectate or Pepto-Bismol is good. You can pick up echinacea or Floristor for the diarrhea. For minor trauma, ace bandages are a good idea to have in this list. For minor splinters, some tweezers, an instant cold pack, a couple of gauze bandages, betadine swabs, some adhesive tape, and some other non-sterile gauze rolls. Now, traveling with children and infants, that always poses a challenge. Some families like to use the adoption travel trip to double as a family vacation in order to see a part of the world that they would not be able to see under ordinary circumstances. As with any family vacation, traveling with children, especially to third world nations, is not an easy task. Young children have difficulty tolerating extreme weather conditions. They have problems with dehydration and reduced nutritional intake. Parents need to educate themselves in order to identify the signs and symptoms of serious medical problems and understand how to deal with them should the need arise. Infants are more prone to illness because they have an immature immune system, and sometimes they may be deficient in their primary vaccination series. Traveling with older children and teenagers especially poses problems in of themselves. Basically, they pose problems with safety-related concerns. Parents may be very busy with the adoption proceedings, and appropriate, consistent, and continuous supervision of the child may unintentionally be temporarily reduced. A lack of attention or supervision to your preschool child obviously will give this child time to get into trouble. Adolescents may find opportunities to participate in potentially risky activities such as drug, alcohol, sex, and travel in unsafe motor vehicles. As a parent, it is imperative to be knowledgeable to these potentially hazardous behaviors and to speak to your youngster frankly with regard to how to deal with them should the event arise. Now, I'd like to share with you some tips before you travel. You should review your health insurance benefits. Investigate if your health plan furnishes medical coverage for you and your family while you are overseas, especially for hospitalizations. Sometimes it may be necessary to obtain some supplemental health coverage while traveling overseas. Evacuation insurance is also very important should a severe medical emergency arise and you or a family member needs to be airlifted to another country for medical management. You should also try to locate the names and the telephone numbers of different travel clinics in the vicinity of the country that you will be visiting. Parents need to record the telephone numbers of all the household members, physicians, and pediatricians in case you need to contact them. And you should make sure that your child's vaccination status is up to date and obtain any special vaccines that are indicated for that particular country. Now, I'd like to share some tips while traveling on a plane with a small child. You should try to provide sufficient entertainment and distractions to effectively keep your child occupied for the duration of the entire plane flight. A portable DVD player, Game Boy, books, puzzles, and their favorite toy are sufficient to keep even the most mischievous youngster busy. Sedation in most instances is not required for overnight travel, but for children greater than 2 years of age, a parent may choose to administer a dose of Benadryl in order to help the child to sleep. It is very important that you try a trial dose of Benadryl a few days prior to administration. All children react differently to this medication, and some children may be sleepy, but other children may have a paradoxical response. And this means that instead of becoming sleepy, they become hyperactive and restless. And that's the last thing you would need on a plane flight. Now, some other travel tips for the plane flight. The changes in the cabin pressure can have a painful impact on the child's inner ear. Generally, the act of swallowing, drinking from a bottle can aid with pressure equalization. You should make sure that the child is adequately hydrated during the air travel. Insensible fluid losses happen in flight, and they can cause dryness of the child's mucous membranes, for example, the lips and the mouth. This does not mean that the child is dehydrated. Try not to overfeed the infant because at higher altitudes, occasionally stomach gases tend to increase and the child will encounter abdominal distension and discomfort. Now, I would like to share with you some tips to ensure a healthy stay during your travel. While traveling, particularly to developing countries, the prevention of infectious diseases is of the utmost importance. The most common intestinal problem encountered in tourists can be avoided if simple hand washing and the avoidance of unsafe foods is practiced. When traveling abroad, especially after visiting orphanages, children traveling with you may find themselves playing with other children in the orphanages. They may be on the ground, they may be playing with dirty toys. So please, after you leave the orphanage, wash the child's hands before they eat their dinner. Good hygiene is essential to the avoidance of gastrointestinal infections, and these are transmitted generally via the fecal-oral route. Washing with soap and water or the use of appropriate antibacterial hand wash is sufficient to furnish protection. Like hand washing before meals is very important, choosing safe foods for you and your children during your trip is equally as important. Choosing safe foods for your family can feel like a full-time job, especially under the stressful conditions of international adoption. Getting children to eat in general is a difficult task, but introducing a different cuisine to their diet can make this even more challenging. Water is the most common vector for the transmission of illness. Travelers, particularly to developing nations, should effectively avoid the consumption of local tap water altogether. When dealing with children, parents should be on the lookout for juices that are mixed with tap water, ice cubes, and they should take care when brushing the child's teeth with water. Families should automatically make it a practice of consuming only bottled water. If bottled water is not available, then boiling the water is regarded as a safe alternative. Some foods look good, but are risky. Uncooked fruits and vegetables from which the outer skin has been removed, undercooked meats and seafood, fruit drinks and frozen popsicles. Any food that's washed with water should be cooked before consumption. Milk should always be avoided unless it is pasteurized. Now, sometimes unsafe food products appear in innocent packages. Sandwiches, for example, that are topped with lettuce and tomatoes have been washed with local tap water. Try to avoid that in the children's sandwiches. Fruits that have their skin removed in the outdoor markets may look delicious, but they are often dipped in water to retain their moisture. Such examples would be mangoes, pineapples, and papaya. Now, safety and injury prevention is very, very important during your travel, especially with little children. Accidental injury is the leading cause of death in children that travel internationally. Safety travel measures and extra common sense during your voyage can aid to reduce the potential risk of accidental injury in children. Seatbelt safety while traveling in vehicles is still the most important means of preventing accidental death in children. Seatbelts may not be consistently available in all the automobiles that you may be traveling in. In cases where there is no seatbelt in the automobile, carefully positioning the child traveler in the rear seat is safer than in the front seat. Now, the physical environment can also pose some dangers that families do not realize. Children are explorers by nature and are guaranteed to detect the potential dangers before their parents do. Parents should inspect the child's environment during their travel continuously. They should watch for exposed electrical wires, outlets, broken glass. Some of the buildings that you may be visiting may be of the older type. They can be decaying. There may be inadequate guardrails on the stairs. Definitely there will be a lack of window guards. Now, the lost child. The most devastating feeling that a parent can experience is when they turn around and their child is no longer there. Children can become accidentally separated from their families during their adoption journey. The commotion of visiting the orphanages, conversing with facilitators, doctors, and successfully completing the millions of forms can lessen the parents' supervision of their other children. It just takes a split second for your naive child to get lost. Personal information such as the child's name, address, the hotel that the family will be staying at, and contact telephone numbers should be placed in the child's pocket in case of such an event. Now, some other safety concerns. Mosquitoes. In third world countries, they are a frequent transport medium for life-threatening illnesses such as malaria, Japanese encephalitis. Barrier protection with sufficient clothing, cover-up, protective nets, and personal insecticides are essential to preventing exposure to such diseases. Your adoption journey should be a memorable experience for you and your family. Careful preparation and extensive guidance before you travel can effectively make this trip an enjoyable event, and not a memory laden with medical illnesses, hospitals, and physicians. Now, the moment we've all been waiting for. Let's meet our child. This is a long-awaited moment that parents think about over and over again, how it's going to be when they first meet their child. They play this tape over and over again. Unfortunately, many parents think that when they arrive at the orphanage, they'll go in a room, the child will come running in their arms, they'll be happy, they'll be cheerful, responsive. You know what? The reality is the children never do this. The children are scared, they're intimidated, they see a stranger that speaks a different language, and sometimes they're ill. And I see this over and over again when families send me video clips of their child during a blind referral evaluation. And I see the sequence of footage as days progress. The usual sequence is on day number 1, the child is generally sad, aloof, not interacting with the child, basically doesn't do anything. It's like a washcloth. On day number 2, the child may look at the parents, may respond a little bit, may even interact. By day number 3, the child may vocalize a little bit, interact even more with the parent. Day number 4, the child may cling to the mother, smile even more, and then attachment begins. Now, I would like to share with you some common behaviors that are encountered during the immediate post-adoption period. This is some transitionary issues that occur. Feeding difficulties are common. The preoccupation with the availability of food. Sleep disorders, common. Sometimes we have emotional decompensation when the child is faced with past stressful events. We often see self-stimulating behaviors, indiscriminate friendliness or over-friendliness. Pain insensitivity in the child, or hypersensitivity to touch, taste, light, and sound. Now, the most common issues that you will encounter, especially in the first night that you pick up your child and stay in that hotel room, is sleep. Sleep issues. Getting through the night in the immediate post-adoption period is always a challenge, especially if you're living in a hotel room far, far away from your home. These disturbances are extremely common and can linger on for a couple of months even after arrival to the United States. We have the anxiety of going to sleep. We have self-stimulating behaviors such as headbanging, rocking, nightmares, and night terrors. These are some of the common sleep disturbances often encountered in this group of children. The reasons why sleep disturbances are so common should not surprise anyone, considering the magnitude of change that these children experience during the adoption process. Now, if you think about it, in the orphanage, the children usually share a bed with other children, and the room is shared with a multitude of other children. They never sleep alone. And in some countries, such as Asian countries, the children are accustomed to sleeping with the foster mother. There is always another human body near them to comfort them in their little minds and protect them from the dangers of the night, the monsters in the closet. Sometimes the imagined possibility that the adoptive parent might disappear is enough to scare almost any child. Now, feeding issues. That is another common issue that we find in the post-adoption period. Feeding time may be one of the most difficult moments in this transition period. In the orphanage, children were accustomed to eating foods that have a soft consistency. It's mashed. This was done in order to prevent choking. Oftentimes, the internationally adopted child may have difficulty with chewing foods of higher consistency and solid food. So be very, very careful. At least at the beginning, mash up the food very, very well, even if the child is bigger and has a full set of teeth in the mouth. They may have difficulties. And think about it, they may also have problems with the dramatic change in their dietary intake. They just may not like American food. Try to keep their diet similar to what they had in the orphanage, at least for the first couple of weeks. Issues with bathing. Bathing time is not a fun time for orphan children that live in an institution. Baths were generally a hurried event, and they used a lot of cold water and soap that would go into their eyes and cause pain. Caregivers had different approaches to this routine. Some caregivers were very quick and rough. Other caregivers were a little bit more kind. So bathing was never fun for orphan children. Now, I would like to speak with you about the peculiar institutional behaviors that we often see in these children. Head banging and body rocking, blank staring at their hands, flipping in the bed before they go to bed. These are all considered self-stimulating behaviors. Basically, the children are bored, and they soothe themselves to sleep. One would say that these are normal reactions to an abnormal environment. Now, as a parent, witnessing such behaviors is very disturbing. Over time, I promise you, these behaviors will diminish and ultimately self-extinguish. All that needs to be done for these children is to make sure that the child is safe. During times of stress, however, these behaviors may reappear temporarily. Now I'd like to share with you a case of rocking and headbanging in a little child named Andre. Little Andre arrived to the United States at 2 years of age. At the post-adoption evaluation, his mother spoke to me about her concerns that Andre was rocking back and forth and banging his head before he would fall asleep. This ritual generally lasted approximately 25 minutes, after which time the child fell asleep. Over a number of months, this behavior disappeared completely. One day, Andre and his mother were involved in a car accident. Andre's mother was rendered unconscious while Andre was safely buckled up in his car seat crying in the back seat. Since his mother was unconscious, his cries went unheard. Shortly after the incident, the police and the fire department arrived. There was a lot of noise and commotion. Andre was separated from his mother. Fortunately, after a few hours, they both were reunited in the hospital, and there were no major medical issues or surgical issues. That very night, Andre's rocking behavior and headbanging reoccurred. Obviously, this was due to traumatic stress. Now, 2 years have passed since Andre's car accident, and the headbanging and the rocking has since disappeared once again. Now, I'd like to share with you some post-arrival transition tips to help your child transition from the orphanage to family life. The transition between the orphanage and the child's new home can be eased if the parents are aware of a few simple measures. Firstly, do not overstimulate your child. Avoid trips to the mall, to Disneyland, to places where there's a lot of noise and commotion. The child should be placed in a well-structured routine. Do not let him become the center of attention. Parents should stay at home as long as possible in the immediate post-arrival period with the child in order to foster attachment. The child should be exposed only to close family members during the immediate post-adoption period. Now, transitioning the child, you should try to avoid daycare, if at all possible, immediately after arrival. This helps to foster better attachment with the parents. If you really think about it, foster care is an environment that is similar to an orphanage. There's a lot of children in an area with a different caregiver every day. The child needs a parent. You should try to learn simple words in the child's native language in order to communicate with him, at least for him to understand simple routine commands. The child will learn English quickly. Older children should be enrolled in school as soon as possible. You should insist that the child be placed in mainstream classes. Language skills will develop rather quickly if the child is exposed to the English language. You should initially try to recreate a diet for the child that is similar to the orphanage diet, and then gradually transition them to your family's diet. You should be aware that children tend to become fixated on junk food, such as hot dogs, sweets, potato chips, and soda. You should set limits before it becomes an obsession. You should avoid television shows, especially the ones that have aggressive tendencies. Children tend to imitate what they see. Having a 5-year-old watch Power Rangers after leaving an orphanage is almost a guarantee to have a little Power Ranger in your living room wrecking your furniture very soon. Children need to earn activities and privileges based on their daily performances. Behaviors need to be rewarded that are good, and bad behaviors need to be gently punished by taking away privileges. For example, taking away their favorite toy for a short period of time. Corporal punishment, however, should never be used. Now, adopting a post-institutionalized child is a difficult undertaking, but for those who are adequately educated and prepared, will do very well to help their child succeed. But if your expectations for international adoptions are that all you need to do is travel overseas, pick up your child, put him into Gap clothing, and expect the child to function in our society without any difficulties, then maybe international adoption is not the right choice. The post-adoption physician's appointment is also a very important part of the transition period. The post-adoption medical screening exam generally occurs 2 weeks after you arrive to the United States with your child. This time is needed in order to observe your child in his or her new environment. You need to get accustomed to the child, you need to learn about his likes and dislikes, and you need to see if there's anything that needs to be attended to medically. I have recently been experiencing cases where the adoption agency is mandating that the child be seen within 48 hours after arrival. These short visits are generally in order to perform a quick medical evaluation of the child in order to determine if the child has any immediate medical needs that need to be treated. Now I'd like to leave you with some final thoughts on international adoption, travel, and transitioning. International adoption travel. This can be a very stressful experience for some families. However, if you plan accordingly and avoid the health and safety related problems associated with travel, then this trip can be a rewarding experience visiting parts of the world that under ordinary circumstances you may not have ever had the opportunity to do so. I'd like to thank you for taking the time to view International Travel and Transitioning 101. Please proceed to the test-taking portion of this class. After you successfully completed the test, a certificate of completion will be deliberated to you that you can present to your adoption agency to put into your file. I thank you, and please visit us at adoptioneducationclasses.com for other educational classes and seminars.